You can run 10 kilometers every single week, feel fantastic, and still be slowly, silently dying inside your own chest. Somewhere behind your ribs, a blockage the size of a coin could be growing right now without a single warning sign. Doctors have a name for the worst version of this hidden killer, and they call it the Widowmaker for a reason. It sits inside the artery that feeds the front wall of your heart, the exact muscle keeping you alive. Half of all men who develop heart disease never get chest pain, never get warning, never get a second chance. Their very first symptom is sudden death, collapsing without explanation in the middle of an ordinary day. That should terrify you a little, because it means feeling healthy proves absolutely nothing about what's happening inside your arteries. Your body is a master of disguise, hiding catastrophic damage behind a mask of normal energy and normal breathing. To understand how this happens, we need to look at the heart like an engine, and engines need fuel lines. The heart muscle burns through oxygen faster than almost any other tissue in your entire body. That oxygen travels through a delicate network wrapped around the heart called the coronary arteries. Ancient anatomists thought these vessels looked like a crown resting on top of the heart, but picture them instead as the root system feeding a massive ancient tree. Sever a small root and one branch dies, but the tree survives just fine. Sever the trunk root, though, and the entire tree collapses within seconds, no branches spared. The left anterior descending artery is that trunk root, feeding the heart's strongest pumping chamber. Emergency doctors have a grim nickname for it, whispered in every hospital hallway across the world. They call it the Widowmaker, and the name is earned through pure, brutal geometry. Block that vessel completely, and you don't lose a leaf, you lose the whole tree instantly. So how does a blockage form inside someone who runs, lifts, and eats reasonably well? It starts inside the artery wall, a lining so smooth it should feel like glass. In a perfect body, blood slides through effortlessly, no friction, no drama, no damage at all. But decades of high blood pressure, high blood sugar, and cigarette smoke act like sandpaper. Even years of intense endurance training can create microscopic tears in that delicate lining. Once damage appears, your body rushes in to repair it immediately, almost like patching drywall. It sends cholesterol to the wound site, hoping to seal the tiny scratch shut. Then immune cells arrive to inspect the patch, consuming cholesterol until they transform into foam cells. That hardened mixture of cholesterol, calcium, and cellular debris becomes something doctors call plaque. This slow, silent buildup inside your arteries has a medical name, atherosclerosis, and it's incredibly common. Here's the misconception that quietly kills thousands of people every single year without warning. Most people imagine plaque like a clogged sink, narrowing gradually until water simply stops flowing. They assume symptoms would appear gradually, shortness of breath first, then chest pain, then collapse. That assumption feels logical, reasonable, even scientific, but biologically, it is completely wrong. Your artery doesn't just sit there and narrow helplessly while plaque piles up inside. Instead, the artery wall stretches outward to accommodate the growing plaque, keeping the opening wide. Doctors call this positive remodeling, and it's simultaneously brilliant and dangerous beyond words. You can carry a massive plaque burden while blood flows through completely normally, unrestricted. That's why you can run a full 10 kilometers and genuinely feel incredible the entire way. The tube inside your artery stays open, even while disaster quietly assembles itself along the walls. This single biological trick explains why sudden death is often the very first symptom.
50% of men and 64% of women never get any warning whatsoever. They feel completely normal until the exact second their heart simply stops working. So what actually flips the switch, turning a silent, hidden plaque into a fatal event? It all comes down to one word: stability. And most plaques are far less stable than expected. Picture that plaque like a small blister, covered only by a thin, fragile layer of skin.
Underneath sits soft, inflamed material, unstable and dangerously reactive to sudden physical stress. A spike in blood pressure or an intense burst of exertion can tear that thin covering apart. This moment has a name: plaque rupture, and it changes everything within minutes. Once the plaque tears open, its contents spill directly into the bloodstream instantly. Your body panics, mistaking this rupture for an open wound that needs immediate repair. It rushes platelets to the site, forming a clot exactly like it would for a cut finger. That reflex saves your life when you slice your hand chopping vegetables in the kitchen. Inside a coronary artery, though, that same reflex becomes an execution rather than a rescue. Within minutes, the clot grows large enough to completely seal off blood flow entirely. It works like a cork jammed violently into the neck of a wine bottle. This sudden, catastrophic blockage is what doctors classify as a type 1 heart attack. But there's a second, quieter version that often ambushes disciplined endurance athletes mid-workout. Imagine a 50-year-old runner named Robert. Healthy cholesterol, strong resting heart rate, no history. During a race, Robert doesn't feel crushing chest pain or classic movie-style symptoms at all. He just feels strange, lightheaded, nauseous, and assumes dehydration is the obvious, simple explanation. At the hospital, doctors find a protein called troponin leaking steadily into his bloodstream. Think of troponin like liquid trapped safely inside a plastic glow stick casing. Snap that stick and the liquid leaks out immediately, exactly like damaged heart muscle cells. Robert is absolutely having a heart attack, yet his artery isn't even close to fully blocked. Doctors find only a 50% blockage, nowhere near what most people assume causes disaster. So how does a heart attack happen with blood still actively flowing through the artery? This is purely a supply and demand problem hiding inside ordinary daily physiology. Sitting calmly on the couch, a 50% blockage barely matters. Plenty of blood still passes through. It's like a garden hose, slightly crimped, still watering the lawn just fine. But once Robert's heart rate spikes to 170 beats every single minute, everything changes. His heart suddenly demands fire hose levels of blood flow to keep functioning properly. The crimped, narrowed artery can only deliver a fraction of what's urgently needed now. Demand crushes supply, and the heart muscle literally begins suffocating from the inside out. Doctors call this ischemia, a fancy word for tissue quietly starving from lack of oxygen. In Robert's case, an extra complication made everything dramatically worse within just minutes. He also had atrial fibrillation, a chaotic electrical malfunction disrupting his heart's normal rhythm. Your heart runs on precise electrical signals, coordinating every single squeeze like clockwork. In atrial fibrillation, the upper chambers stop beating properly and start quivering chaotically instead. Combine that chaos with a partial blockage and rapid heartbeat, and disaster becomes almost guaranteed. The heart beats too fast to properly fill, while arteries can't deliver enough desperately needed oxygen. This combination reveals something doctors call the 70% threshold, a critical, dangerous turning point. Generally, chest pain doesn't appear until an artery becomes roughly 70% blocked or worse.
Below that number, your heart compensates quietly, hiding the problem behind completely normal daily energy. Above that threshold, you might feel tightness climbing stairs that disappears immediately once you rest. Doctors call this stable angina, essentially your body's built-in, old-fashioned check engine light. But here's the terrifying twist nobody expects. Most heart attacks happen below 50% blockage. Soft, unstable plaques rupture far more easily than large, hardened, seemingly dangerous-looking blockages ever do. So if you genuinely cannot feel any of this happening, is there any actual good news? Yes. Your heart has a hidden backup system called collateral circulation, quietly working behind the scenes. Think of your main coronary arteries as busy interstates carrying essential traffic across the body. When a slow traffic jam persists for years, your heart secretly builds smaller side street detours. This explains why a 70-year-old sometimes survives a heart attack that kills someone younger. Their older heart had decades of warning. quietly building detour routes around the dangerous blockage. A younger person's rupture happens suddenly with no detours built, no backup plan available whatsoever. One of the best ways to force these detour vessels to grow is consistent exercise. Zone 2 training and occasional high-intensity intervals both encourage your heart to build backup routes. This buys you something incredibly valuable: time. And time is genuinely the only currency that matters. Inside every emergency room, doctors repeat one simple phrase constantly: time is muscle. Always remember that. After 20 minutes without blood flow, irreversible muscle damage begins spreading through the affected tissue quickly. After 90 minutes, that damaged heart tissue turns permanently into scar tissue, and scar tissue never pumps. To save the muscle, you absolutely have to recognize the warning symptoms immediately, without hesitation or denial. Men typically experience the classic, dramatic version: crushing chest pressure, radiating painfully down the left arm. Women often experience something far sneakier: extreme fatigue, shortness of breath, or unexplained intense acid reflux. If you ever feel a sudden, overwhelming sense of doom, please don't ignore that feeling casually. When the plumbing genuinely fails, cardiologists perform a procedure called PCI to fix everything quickly. They thread a thin, flexible tube through your wrist, guiding it carefully toward the blocked artery. Using special dye, they locate the exact jam, then inflate a tiny balloon forcefully. That balloon crushes the plaque flat against the artery wall, instantly restoring normal blood flow again. Afterward, they deploy a stent, a small metal mesh scaffold holding the artery permanently open. Now let's talk about finding this hidden threat before it ever becomes a genuine emergency. The entire goal is discovering the fire hazard long before your house actually catches fire. Standard blood work only reveals the ingredients floating inside your blood, nothing about your artery walls. You need better, more specific data if you genuinely want to understand your real risk. A coronary calcium score is a quick, 5-minute scan detecting hardened calcium deposits precisely. A score of 0 is genuinely excellent news, essentially the best possible outcome available today. A score above 400, though, represents a serious ticking time bomb requiring immediate medical attention. The next level up is called a CT angiogram, revealing something calcium scores completely miss. It detects soft, unstable plaque, the invisible, dangerous blisters that haven't hardened into calcium yet. This scan is genuinely the ultimate early warning system available in modern preventative cardiology today. The tragedy of a healthy person's heart attack is almost always a tragedy of pure ignorance. Controlling blood pressure stops the constant mechanical tearing happening quietly inside your fragile artery walls. Managing blood sugar prevents dangerous inflammation, while consistent movement keeps your collateral circulation strong and ready. Don't guess whether you're truly healthy based purely on how fast you can run. Use the technology available today, ask your doctor real questions, and finally know for absolute certain.